Hello, everyone. Well, we are, as women, all of us, as we start inching towards mid-age, we start aging, we know that. But what can we do to make sure that we keep looking great, right? The collagen is one of the topics. What are the natural alternatives for collagen? That's what I wanted to bring today as per Ayurveda. So we have an expert today, Dr. Ramitha. She is joining me from Bangalore. She is an Ayurvedic doctor who specializes on mid-age women issues like hormonal imbalance and other issues. Namaste, and thank you so much, Dr. Ramitha, for joining me.
Hello, everybody. Namaste. My pleasure to be here.
So do you want to just give us an overview from Ayurveda? We can talk about collagen alternatives, natural alternatives for collagen, because a lot of women nowadays go for fillers and Botox, all those things, right? So,
Yes.
So we want to hear what Ayurveda talks about.
So the thing is, like, all we hear is collagen these days. So first of all, we need to know what exactly is this collagen and why is it so important for mid-aged women in particular? Why not for others? So basically, when we say collagen, it is nothing but a protein. In fact, a very hard protein, which is insoluble and which constitutes about 70 to 75% of your skin structural framework. So this is the one which basically makes your skin elasticity, the one which hydrates your skin, as well as the one which rejuvenates your skin. So it is very important to keep your collagen in check. So what happens is when you age, your collagen production reduces, as well as the dead skin cells, which is present in your face or in your skin, will be staying as it is. It is not removed naturally by your body. So this is where the collagen damage occurs. Hence, collagen is given more importance these days since people know what exactly is happening, right?
Absolutely. So we understand Ayurveda has talks a lot about balancing the doshas, right? So now,
Yes.
now as a mid-aged woman, there is the hormonal imbalance that's happening. There is the perimenopause that's happening. There's a lot of fluctuations. Estrogen is going down, and then people are talking about hormonal replacement therapy, and then the skin is not as beautiful as we were. We are in our 20s. So all those things, could you give us, this is a quick 10-minute session, but something that what Ayurveda has in its little beautiful portly or whatever I want to call.
Yes, definitely. Are you able to hear me?
Yeah, please go ahead. Please go ahead.
So in Ayurveda, we basically have this age group, which is called as Parihani. That means you are in the age group of 40 to 60-year-old. So this is when your skin issues begin to start. So this is where there is oxidative stress and there are lots of free radicals in your body. These free radicals are the ones which damage your collagen to the maximum. So what happens is, in this parihani or vruddhapya, above 60 or 40 to 60 years, this is when you're going through your menopause. Either it could be before your menopause, during or after the menopause. This is when your drop of collagen occurs at maximum. So this is when you realize that when you smile or when you get angry, you have fine lines, there are wrinkles on your forehead, all these tiny minute details you start noticing. And also, to speak about hormones, there is drastic change in your hormone levels, which might fuel to the fire, So we have a lot of Ayurvedic options which help to build your collagen in the most natural way possible. I'll also talk about few herbs which will help you build your collagen naturally.
Okay, so do you want to talk a little bit about them? We have only 5 more minutes or few minutes, so maybe give some examples. We don't want to go, this is not a medical advice, but just general examples.
Okay, sure. One such wonder herb which I would like to tell all of you is the amalaki. So amalaki or Indian gooseberry, the scientific name is Ambelica officinalis. This is one such herb which has undergone lots and lots and lots of research. So if you say you need scientific data about a particular herb to believe in it, you have it. You have lots and lots of it. So this is one such herb which has an action on your DNA. So basically DNA, imagine it as a stick, all right? So there are two things which are at the ends of your DNA, which when it is replicating or when it is dividing, it becomes shorter and shorter and shorter. So amalaki is one herb which will help DNA retain its telomere or retain the size of the DNA as it is. So the cell aging is delayed to an extent that you keep your collagen intact. So that fine lines when you smile or those wrinkles, all these will be delayed by around 5 to 10 years. So you have scientific data to support this as well. This is one small tiny example that I'm telling because we have time constraint and I cannot go very deep into this matter. So amalaki or Indian gooseberry is one wonder drug, two go drug, and I'll explain about different forms in which it is available, how you can use probably in the upcoming sessions or in another live chat.
What else? What about Shatavari and some of the other herbs or some concoctions and some? Do you want to give us a few more examples? Maybe 2 or 3 more examples for women.
Yeah. So what I spoke about amalaki, it is a collagen building material. So this comes under that category. So when I say about Ayurveda herbs, you basically divide them into 3 categories. One is Vayasthapana. That is the one which helps you delay the aging, which keeps your collagen intact. Another category is Varnya, which helps you keep up with your complexion so that you don't look dull or you don't, have that saggy face once you age. Another one is Tvacha, that is, which is conducive to your skin. And another concept that I had was Rasayana or rejuvenation. And the most popular drug is Shatavari and kumari. Kumari also known as aloe vera. So these are the ones which have plenty and plenty of antioxidants in them, as well as there are other herbs like guduchi, which you call as Tinopora cordifolia. And there is another popular drug in the West that is turmeric, or what we call as haridra. This particular one also has lots of scientific data which supports the fact that it delays aging. That is, it has an active ingredient or active agent which we call as curcumin. So this is one such thing which helps you age gracefully, as you say it in a very healthy way. So these are some of the herbs, some of the drugs which can be used in various forms, internally as well as externally. Internally, we can use it in the form of churna, what we say in Ayurveda, that is in the form of powder, in the form of vati, that is in the form of pills or tablets that you get it online or in any drugstores, or in the form of kashaya, that is herbal decoctions. These are various forms in which you can use these herbs. And also externally, that is, you can use in the form of lepa, that is in the form of paste, right? But one contraindication is that, like I said, there are 3 layers of the skin, that epidermis, dermis, and hypodermis. Your collagen is in the middle layer of your skin. So whatever you're applying on your skin does not necessarily pierce the upper layer and go to the middle layer. So it might help you with your complexion, but not necessarily with your collagen buildup, right? So these are some of the herbs, some of the ways in which you can use.
Okay. So we just wanted to talk about that there is an alternative today. Yes. And Ayurveda has these beautiful herbs that Dr. Ranjita talked about, like 4 or 5 herbs. How to use them is not what we're going to talk about today. We just wanted to introduce the whole concept that there are alternatives to collagen when it starts going down, and use it properly. That is the key word here. You have to use all these herbs. Don't just start taking everything and thinking that you're going to look again like your 20s. That's not how you do it. You have to do them properly, right? Do you want to talk a little bit about that before I wrap up today? That the herbs have to be taken properly, right?
Yes, exactly. Not randomly Googling some things and finding the names and using it randomly does not serve any purpose. So, like I said, Rasayana, this is something very deep concept in which there are different layers to the treatment. You cannot randomly start consuming a herb. You need to go through different processes known as pre-process, the main process, as well as post-process, during which there are various things based on your body type. That is, whether it is Vatic type or Pitta or Kapha, we'll adapt different types of massages to your skin. We give steaming to your skin, and the massage with which you are undergoing the treatment also makes a lot of difference. If you're Vata, you will be given Vata elevating drugs or Vata elevating Tailas, also known as oils, medicinal oils. So these are all important before you start consuming these herbs. First, you need to go through this, or Udvartan, also what we call as powder massage, in case of patients who are having Kapha type of constitution. I'm sorry, did I say patient? Because I'm very used to saying that term. We can say in case of people, right? Because who doesn't want to have a natural looking, youthful skin, right? So these are some of the processes, and yeah, that's how we go about it. Based on your prakriti or based on your body constitution, that is how we decide what type of treatment you're going to undergo.
Okay, well, that's I think that's a very useful information, especially for women out there. You know, we are always looking for little hacks out there, how to keep looking great as we age. There was a quick 10-minute session to really give you an introduction of collagen alternatives, natural alternatives as per Ayurveda. As Dr. Ranjita talked about, there are quite a few herbs, but how you consume the herbs, you need an expert intervention. I want to emphasize that this is not a medical advice. This is just an intro. Anything else you'd like to add before I wrap up today, Dr. Ranjita?
Yeah, one thing I would like to say is that beauty is not just about having a pretty face, right? What is more important is that you got to have a pretty heart, a pretty mind, and most importantly, a beautiful soul. So with that, I would like to end my talk. Namaste.
Namaste. Namaste. Thank you. Thank you so much.
Thank you.